Now I'm going to take a fresh new slide to explain about Waterhammer pulse. And trust me, you don't have to screen through multiple resources, watch multiple YouTube videos to understand about Waterhammer pulse, because I'll explain about it under all topics. That is, what is Waterhammer pulse? What are the various names of Waterhammer pulse? Why those names have been given to it? Where do you get to see Waterhammer pulse? Why does it occur? What is the waveform of Waterhammer pulse and how can you elicit it? Okay, let's begin. So the topic is Waterhammer pulse, which is also referred to as collapsing pulse. First thing first, where do you get to see Waterhammer pulse? So you can appreciate Waterhammer pulse in patients with aortic incompetency or aortic regurgitation. Number 2, in patients with high volume pulse. But remember this very important line. All collapsing pulse are high volume pulse, but let me give a big but here, but all high volume pulse are not necessarily collapsing in nature. That means if a person has collapsing pressure, collapsing pulse, the pulse is high volume in nature. But just because a patient has high volume pulse, that doesn't mean the pulse is gonna be collapsing in nature. Okay? Alright. So let's take the most famous example, that is of aortic regurgitation. In aortic regurgitation, here's your left atrium, here's your left ventricle, and here's your aorta. See, when the left ventricle relaxes or goes through ventricular diastole, the aortic valve closes to prevent the backflow of blood from aorta into the ventricle. But in aortic regurgitation, due to pathology in the aortic valve, it is unable to close properly. As a result, there is backflow of blood from aorta into the ventricle during ventricular relaxation. So ventricular diastole receives blood from two parts. Number 1, the left atrium, which is normal, and number 2, from aorta as well via backflow due to incompetent aortic valve. Since the left ventricle is filled with lots of blood, it is gonna push against the left ventricular wall and cause it to stretch. The large amount of blood causes the wall of the left ventricle to stretch. And as per Starling law, the more the wall of the ventricle stretches, the more strongly it contracts back. So it shows strong contraction. And it is due to the strong contraction of the ventricle that the blood gets pushed out of the ventricle through the aorta to the periphery, and there is sharp rise in pressure inside the aorta. There is sharp push of the blood out into the aorta. There is sharp rise. So why is there sharp rise? The sharp rise is due to the strong contraction of highly overfilled left ventricle. But then when the ventricle relaxes, the blood from the aorta, it regurgitates back. As a result, there is sudden fall in pressure inside the aorta. There is a sharp fall as well. There is a sharp rise and a sharp fall. Okay, so why is there sharp rise? The sharp rise is as a result of strong left ventricular systole following the stretch. And why is there sharp fall? The sharp fall is because of regurgitation of blood from aorta to left ventricle. Regurgitation. Okay. Alright, so that's the pulse waveform. Now, what are the various names given to it? Waterhammer pulse is referred to as collapsing pulse because when the ventricle relaxes, there is sudden drop in blood pressure as the blood falls back suddenly. So there is rapid downstroke of blood due to regurgitation. Why is it called bounding pulse? It's called bounding pulse because the rapid upstroke due to strong contraction of the left ventricle hits your fingertips like third of a hammer, like third of hammer. See, since there is a rapid upstroke due to strong contraction of the left ventricle, the pulse, it's quite strong, and the pulse hits against the tip of your finger like a third of a hammer. That's why it's called bounding pulse, a strong striking pulse, a strong striking pulse. Why is it called a Waterhammer pulse? It's called a Waterhammer pulse because it shows phenomenon like a toy called Waterhammer. In this toy, what you have is a cylindrical glass tube which is closed from both the ends, and it is filled with water halfway, and half of the tube is vacuum. So when you shake the tube, the water jumps up, and when it falls down so strongly that it hits the end of the glass tube, producing a third sound. So this is similar to your Waterhammer pulse, because when the column of blood, the pressure wave strikes the peripheral artery, you can feel it like the thud of a hammer. You can feel a strong pulse. Why is it called a Watson's pulse? It's called a Watson's pulse because the name was named by the Waterhammer pulse was named by Thomas Watson. Alright, since there is a sharp rise in pressure, obviously the systolic blood pressure is high. Since the systolic blood pressure is high, the difference between the baseline and the peak is also high. That means the pulse pressure is greater than 60 mm of Hg, and that is why what you get is a high volume pulse. Now let's see how we can elicit this Waterhammer pulse or collapsing pulse in a patient while bedside. To elicit Waterhammer pulse, first you need to make sure that the patient doesn't have any shoulder injury, shoulder pain or shoulder discomfort. That is because while eliciting this pulse, there is gonna be movement at the shoulder joint. Second, in order to elicit Waterhammer pulse in the right upper limb of the patient, you are gonna stand on the right side of the patient and use your right palm, and vice versa. That is, if you have to elicit Waterhammer pulse on the left upper limb of the patient, you use your left palm. Now, with your right palm, you are going to wrap it around the right wrist of the patient, making sure that the waves of the palm lie over the radial artery, while the rest of the palm lies over the ulnar artery. So you wrap around the wrist from behind such that the waves lie over the radial artery and the rest of the palm will automatically lie over the ulnar artery. On doing so, you will be able to feel a strong pulse if the person has aortic regurgitation. Now, start squeezing the wrist till the pulse is obliterated. Then release tension slowly from the wrist till the pulse is feebly or lightly felt. Then with the help of your left hand, provide support just below the elbow joint, because you want movement only at the shoulder joint, not the elbow joint. Since I'm using my left arm to record the video, I'd expect it to be done by you on your own. After that, as you are feebly feeling the pulse with your right palm, you need to raise the upper limb abruptly above the level of head. On doing so, now the pulse becomes much stronger. That is, the bounding nature of the pulse due to rapid upstroke and the collapsing nature of the pulse due to rapid downstroke become exaggerated. You will be able to appreciate the diastolic runoff of the pulse. The reason the arm is lifted above the level of the head is because of two reasons. Number one, due to gravity, more blood falls down and there is exaggerated ejection. And number two, the arteries are in more line with the aorta. As a result, there is a rapid ejection of blood as well as a rapid downfall, exaggerating the phenomenon of bounding and collapsing pulse. And this is how you elicit Waterhammer pulse. Next is